Give me 1 minute, please. I have to. Okay. Welcome, everyone. It's a very good pleasure to see all your faces. Sorry, I have to mute the volume for YouTube. I don't know how to do that. Can you hear me okay?
Yeah.
Okay. So my name is Saga Mbianda, for those who do not know me, specifically Stephanie. I'm the Community Engagement Manager here with Mana Food Center. So Break and Bread is a monthly conversation that we hold every last Wednesday of the month with people like you and individual in the community, other food providers, and other partners. So we talk about all the topics that we can use to find solutions about food insecurity in our community. So last month we discussed how food is a necessity for everyone, but the lack of it can lead to increase the levels of stress and more negative effects on people's mental health. So we noticed last week that hunger does not affect only people's physical health, but also their mental health. So for today, we would like to discuss how immigrants have access to food in Montgomery County, because Mana Food Works serve only Montgomery County residents for now. So what I noticed is that studies show that around 32.3% of Montgomery County residents are foreign born, and 6.54% of them don't speak English well. So we know that there are many barriers such as stigma, language, cultural beliefs that can prevent immigrants to access food and other benefits. Before we discuss that, I would like to let you know that the White House is organizing a conference on September this year on hunger, health, and nutrition. And it's been more than 50 years, I think, since the first and only White House conference on food. So maybe it's an opportunity for us to also think about some of the things that we can share here, and some of the problems and challenges that we face on our day-to-day work, so that they can take some of our ideas to shape the agenda for that national White House conference. I will be there. So before that, I would like us to go to share some community share something about our personal life, like something new or something good that we notice in our life since the tree last week. So something good in your life, or something that you think it's good to share with us here.
I can start.
Yes.
I have the privilege to have my mom. My mom is visit me from my country. This is the good thing that I have right now, taking care of her. She's almost 80 years old. And then we spend time together. We laugh together since last week. So I'm very happy because I have my mom here.
Hi, this is Angie. I work for MANA as Senior Director of People and Culture. And my new and good is similar to Marlene's. And my mom is not here with me, but I did get to see her very recently. We went together to my nephew's high school graduation, and then our whole family spent the week together. So that was very enjoyable.
I can share next. So I kind of mentioned it at the very beginning before a lot of you guys joined, but right now I'm currently an intern for Share Our Strength. So I guess I'm like the only one that isn't part of, is it Mana? Mana? So yeah, super cool to meet everybody. And I guess that kind of goes back to the, like what is good right now is that I am interning for this really great organization that is, I guess, allowing me to, because I asked if I could come to this. It wasn't like something that was on our calendar, like on the agenda. And I was like, yeah, can I come and sit in on this like monthly meeting that they have? So I think I'm already like kind of like, I'm taking advantage of like everything that they have to offer, like what I learn from the organization or like who I get to meet. So I think it's a really good opportunity. And I think that's probably the highlight of my past week, I guess. I barely started on Monday, so yeah.
Thank you so much for sharing. Nancy, can you help me to mute the volume of YouTube, please? I sent you a text message.
Hi, Agar. I did mute it. So I did mute it from on my computer, but let me go check first on the YouTube itself if this can.
Okay.
Yeah.
Okay, moving. Okay, thank you so much for sharing what you experienced during the past 3 weeks. We just move forward with what we were talking about, how I would like to hear your perspective about how immigrants have access to food in Montgomery County and on how food insecurity disproportionately impacts some groups in the county. So anyone can start, share your experience with your family, your people in the community, or your community group, or yourself. Yeah, anyone can start.
I think one of the challenges of trying to support immigrant communities in Montgomery County is making sure that they know that MANA is a safe place for them, especially in the state of our country for the past couple years and currently. I think a lot of what would drive someone to not seek out resources is the fear of them not being a safe space for them or not having confidentiality, et cetera, especially for undocumented immigrants. So I think that's one of the challenges of trying to support immigrant communities. And in my position, I haven't directly experienced like communicating with people who seek out our services that are immigrants, but I'm curious about other people's perspectives and yours, Agar, especially with your community engagement roles, what your experience has been.
Thank you so much for sharing that. So as an immigrant myself, I'm seeing a lot of things that you just said in my personal life. So it wasn't very easy for me to have access to some of the benefit because of language barriers, because of stigma, because sometimes you have this, this kind of pride. So you don't want people to know that you need something. And even if you know where to find that thing, you don't want to go there just because you don't want to show them that you are in need. And you need someone that you trust to have, so that that person connect you with the resource, so that you can go there without thinking about, without having the fear that people will see you. So thank you so much, Hannah Rose, for sharing that. Anyone else?
Well, it's unfortunate that nobody from participant services is available to join right now, because certainly they have you know, a unique perspective on the requests that they're receiving for food assistance from community members. I know that when we have reviewed the statistics for the previous fiscal year, so most recently we would have been looking at numbers from fiscal year 21. We're just about to finish up FY 22. And so before too long, we'll be able to review the statistics for the whole year. But we were able to see, in terms of race and ethnicity, that that communities of color in general are disproportionately reflected in our service numbers. There was a point at the height of the pandemic where the service numbers for people who identify as Hispanic or Latino were in the mid 50% range, which was quite a shift from the year before. Those numbers have shifted back downward a little bit, but still remain, you know, much higher than the proportion that is present in the community as a whole. And so, you know, we have increased the number of Spanish-speaking staff who work in participant services in the call center, so that because the demand for Spanish language is the highest demand that we have. Also, you know, we're putting into place some measures that allow us to have the ability to communicate more effectively with people who speak other languages as their primary language. So the language barriers are a big thing that impacts the ability to receive food assistance and other types of services that people who are new to this community or even not new, but just, you know, have a language barrier that they are experiencing in their need to find safety net services. So I think that participant services hears a lot from people about some of the things that Agar mentioned in terms of feeling some level of shame about reaching out for assistance. And so we really are trying to do our best as an organization to create food distribution experiences that that create a dignified experience and that help people to feel comfortable so that they don't feel shame about coming to ask for food support. I think we all have found ourselves in a place of needing someone to support us in different ways throughout our lives. And so we understand how that can feel, but also know that sometimes it is the best choice that you can make for yourself to reach out and ask for that help. And our job is to do it in the best possible way so that people feel good when they leave. We definitely don't want them to feel worse because of the experience that they had with MANA. I'll stop there.
Yeah, thank you so much, Angie, for sharing that. And I can also say that with the community engagement program, we are working with some partners like Cohort who just joined, because Mana knew at the beginning that there are a lot of people who cannot come to us directly because of those barriers. So we partner with some community groups like Cohort, as I said, Identity, and other groups to reach out to those specific groups. Because we know that when you know someone, it's easier for you to trust that person and get the resources that we have available for them. So we are doing, honestly, Mana is doing a great job to work with those people, paying the stipend for volunteers to go directly in the community, reach out to those people here, listen to what they are saying, connect them with everything that we do here, so that when they come, they see their organization, they see the people who are going through the same problems, and get connected to what we offer here. So that is another example of how we try to help immigrants connect to our resources here. Thank you.
I'll add one other thing that had been on my mind previously. Just the recognition that sometimes the rules that we put in place for people to receive service can create a barrier for them. And Participant Services has been talking about ways to ease up on those things. One thing that shows up quite a bit is having some sort of identification that shows that you are a Montgomery County resident, and just recognizing that when people first move to the area, they may not have had an opportunity to update their ID yet, or they may not have the funds available to pay the cost of getting a new ID. And so just finding ways for people to be able to demonstrate that they are county residents without, having them have to take on a cost that they can't afford, or preventing them from coming forward to ask for food because they know that they don't have the ID that we're requesting. So that's an ongoing conversation about how do we open our doors even wider so that people know that we're finding a way to serve them through this program.
Yeah, thank you, Angie. Marlene, do you want to share something with your community?
Yeah, it's everything that Angie and you share is true. The majority of immigrant has lack of information, and the language barrier is one of everything that Angie and you share is true. Many
Agar, why don't you mute while you're not talking so that we don't hear what's coming through for you. I think that will help.
I don't know if you can hear me right now. Oh, okay. So in my experience in to this process, I think that MANA has a beautiful program, and then every time that I have the opportunity to recommend MANA, and then but this true is it's the fear that they have in my community. They have fear if they can ask for food, or if I can go and give all my contact information, they can maybe share with other people, and then I don't want to back to my country. So it's the fear that our community, especially Latino community or another immigrant, has during this process, that they arrive here and they don't have opportunity to access to not just the food, but also the healthcare. Is another issue. Is another component that we have. But as we spread the word about MANA and other institutions that provide food, I think that they will be more comfortable, especially with those people that are leading to them, like in different school and different organizations, like our organization that I provide program intervention about nutrition, and then we have the resource about MANA and other institution, and they can be more confident to be access the food. But it's fear, lack of fear that they have, also lack of information, that they don't know that those institutions can provide food, and also the language barriers. Remember that many of them have many language barriers. Really, they cannot express very well, and then they will have fear for sure. Yeah, and so our commitment, if we work in the community, is to educate to them that they can be there, that they can be confident, that they will, those institutions like MANA can provide the food that they need. Yeah. And then at the end, they will not have some chronic disease or some illness. You know that if we don't have a proper nutrition balance and proper nutrition, we will have this compensation, and then we have malnutrition, we have obesity, we have many stuff that we can prevent. And then MANA is doing a great job in this case.
Thank you so much, Marlene. I think there are few questions on the chat box. Angie is asking what organization do we work with? And the other thing is that how do you address those fears specifically to help people feel more comfortable?
I have an experience. Well, my organization is through the University of Maryland. We are expanding food and nutrition education program that we provide nutrition intervention in different organizations like school-based and health centers, clinic, church, and other organizations that are not profit that they need, and then they see that if our program fits with them, and we educate the community, and the classes is the lesson or workshop are in English and Spanish, and then there are 6 lessons, and then every lesson is about my plate, fruit, vegetable, protein, also whole grains and dairy product. So we go through those lessons, and then at the same time we see the necessity for each group, and then when we provide this intervention, and then what we are expecting is they can have so many change in behavior. And then we are using some curriculum, different curriculum, and this program is national program funded by USDA. So this is the organization that I serve right now. And then I can see many fear from the people, from especially my community, Latino community, that they don't want to go and ask for food or request for food, because if they provide the information, personal information, is not good for them. So I have the experience in the pandemic, when we were closet and then nobody leave from their home. One lady that after my classes, she called me and say, Marlene, I don't have nothing to eat and I have 4 kids. And then just I give to them just water with sugar. And then I don't have money. And then I don't want to be with coronavirus. And then I say, okay, why you don't go to Mana and go to the school and ask for food? No, because I have a fear. If they can know me, maybe they can share my information, and then I will deport her to my country. And say, no, they don't do that. So at that time, I provide many stuff that I have in my home and drop to her home. And then I asked for help from the school that I was serving, and then the site coordinator contact her and then provide more food. Now it's much better, and she is more confident, and I think that she is she asked food to Mana, because we forced to her to go and call, but she has many barriers, lack of the information, because she didn't know about the information about who can provide their food, and also the language barrier and the fear that they have about her personal information, that she doesn't want to share with anyone else.
Well,
Answer
really
your question?
appreciate you. Yes, yeah,
Okay.
I appreciate you sharing that information.
Mhm.
Unfortunately, I think there are a lot of people who are in the same
Sorry.
kind of position of feeling those concerns. So I know that we really appreciate you and other people who are working in the community spreading that information, not just about Mana, but there are a lot of food agencies that are providing support and just making sure that people get food that they need because it's available for them in the county. So thank you for doing that.
And then, of course, you see many people, immigrants, most of the Latino community is without any paper, document. How you say document? Yeah, well, they don't have papers, so they are afraid about that you can provide to other organizations, to the government, that they are without paper, and then they can be deported again. And so in those in Central America, it's a big issue right now, with many people that are arriving here for many reasons. So they don't want to go back. This is the problem.
Yeah, thank you. We definitely do not provide that kind of information to anyone. We're just here to serve. So whoever needs that service is welcome to come. And thank you for, what you're doing to clear that up, that misconception, because we don't want people to be afraid to come and get what they need. Thank you.
Thank you so much. So you saw what I put on the chat box, because I'm hearing both. I don't know how. I tried to mute one, but I'm still hearing both. So I cannot follow the discussion very well. So what I know is that immigrants need to have the information, and then, as you said, they need to be sure that the organization will not use their private information, like letting people know that they are undocumented. And that what Angie was said is that we don't share that kind of information. And I noticed when I was a volunteer for MANA, that when I was asking some questions like that, people were like, "Oh, are you going to share my information with people?" Then no, then I will not take the food. No. And yeah, it was my work to just let them know that no, you are not using that information and sharing those information with some other people. So they need someone to trust, and that's why we are working with them every day to build that kind of trust. We need to ensure them that we are collecting their information not to harm them, but to help them. Even though they don't have documents, they can still benefit or have access to all the benefit or the resources that we have. So I think we have a lot to do at the individual level and with other partners. And if we collaborate, then we will, at a certain point, we help those people have access to everything that we have for them in the community. So I have a follow-up question on that. I would like to hear from you, what are some of the specific actions that you think non-profit organization, community groups, and individuals can take to help those specific group have access to food and fights against food insecurity? What are some of the specific actions that you think? Right now we are talking about the White House conference. So I know that after that kind of conference, something can change on the policies, but they need to hear from us. They need to hear our thoughts, our ideas about how we can solve the problem. What are some of the possible actions that we can take? Yeah. So I want to hear from you. Anyone can go first.
I think one of the biggest things is figuring out what's the best form of outreach. So, do people have access to internet? Do people have access to computers or phones? What's the best way to conduct outreach to various communities in the county? Because people have different levels of resources available to them. And so I think that's one of the first steps in trying to figure out, okay, what's the best way to serve specific communities is dependent on what avenues of outreach are available to them. Yeah.
That's a very good point, Anna Host. Because myself as the community engagement manager, sometimes I don't really know how to do outreach, because I worked with one organization here in East County called Everyday Canvassing. They are knocking at the door, they share the information, but you don't know, not everyone opened the door for people, you know. And we thought about having flyers and share the flyers with people. And then some of them, they don't read flyers. And some may speak only, some people may speak only, let's say Amharic, but we have flyers only in English and Spanish. Some of them are speaking only French, but we have flyers only in English and Spanish. So those kind of things, I think we need to sit down and really figure out what are the ways that we can use to engage our communities. We have community event, we have pop-up pantries here in Mana, at Mana. And honestly, when I'm doing pop-up pantries, it's the best time to talk to people directly. Even if they are not speaking English, I have the experience talking to some people who are speaking only Spanish. I just share this flyer in Spanish and say, okay, read this thing. And this is the phone number, because we have people in our team who are speaking Spanish. Call this number and someone who is speaking Spanish will help you. So at least you share that information. But sometimes you deal with people who are not speaking neither English, neither Spanish, maybe another language. And it becomes very, very, very difficult. Are we canvassing? Are we knocking at the door? Are we sharing information through the internet? Some may not have internet access. Some may not have computers. And now we are having Montgomery Connect, who is distributing computers for all. So yeah, that is a very good question that we have to ask ourselves every time that we are working, and when moving forward, thinking about how we can just adapt and adjust based on what we have on the ground. Thank you.
Regarding the outreach, one of the idea that I have is just by radio or by Facebook Live. Also, you can do your outreach, I think. And then also the good thing that I use many times is just to go to the community and go to with the leaders at the community. For example, at the schools with the liaison coordinators or parents liaison coordinators in the schools, different organizations, you can spread the word, and they have people that maybe can translate your flyer in English and Spanish or another language. So this is the way that maybe can help you. But specifically the radio in English is very accessible.
Thank you. Yeah. So yeah, I think based on each community, we have to find the way that we can better engage them. It's not, we don't have a specific way or a standard way of doing things. We just have to listen to what people are saying in the community and just see how we can adapt. I know that the voucher program that we are having now at Mana, it's one of the result of how they are listening to what people are saying. Because in the past, those who were connecting to our distribution site here and getting the food from us, some of them were saying that, okay, we have the food, but we don't eat this kind of food. Or we eat only some of the items that you are giving us. And Mana's sat down and say, okay, to help those people who cannot eat our food because they don't know about what we are serving here, we don't have a lot of money, but with the money that we have, we can connect some of them with their culturally appropriate food. And we have a small program like that, where we connect West African people, the Ethiopian community, the Eritrean community now, to their culturally appropriate food. We have partnership with local stores, and we give them coupons every month so that people can go there. They get the food from here, they come to the market, they get whatever they want because it's a choice here at Old Columbia Pike. And then they go to those specific market and get their culturally appropriate food, so that we make sure that we give to people what they really need. So that is another kind of building trust and helping people those immigrants who arrive here and don't know about the kind of food that we're eating here. Yeah, so for me, it's good to make sure or to listen to your community and see how they would like things to be done. Yeah. Unfortunately, sometimes we don't have them everywhere, because this kind of space is a space where we need people from the community to come and share what they would like to see or how they would like us to serve them. But sometimes we don't have them because of those barriers that we mentioned at the beginning. Because if someone is not speaking English very well like me, then you don't want to come and say things because you are not sure that people will hear you. So those are the kind of things that I think we need to figure out. We need to listen to what people mention in the community. We need to build that trust, because if they don't trust you, they will not say anything. We build that trust, we become very tolerant. Even if someone is saying things that we don't understand, we have to lean in and try to understand what the person is saying to be able to help them, because we exist because those people are there. If we don't have people who are hungry, then we close the door and go. So yeah, I think we have to adapt and adjust based on what we are hearing. I would like to give to each of the participants a last word so that we conclude our session. We still have 10 minutes to conclude the last round robin. Anyone can go.
I guess I can go first. I guess I just wanted to start by saying thank you guys for opening this space for anybody who's willing and open to joining. I think it was really cool to seeing you guys talk about your experiences and like how things are, I guess, in where you guys are, and hearing about the communities and the populations there. And as you guys were talking, I was also kind of thinking back to like how things are in my city, in my town. And just kind of referring back to like the people that I've worked with or the organizations that I've been a part of. And it's really cool to see the work that is being done everywhere, and that there is people that recognize the challenges that exist, and everyone just wants to do better for the population that they're serving. And yeah, I don't know, I think it was just really, really cool and really nice to hear you guys speak about your experiences and just trying to see how we can always do better. I think that's all we can do.
Thank you so much, Stephanie. Anyone else? Henrietta, are you with us? Henrietta is one of our partners in the voucher program. So she's—
I am. Yes, Iga.
Yeah.
Hi.
Hi.
Hi, everyone. Yes, I am with you guys. Yeah, I've been listening to everything been said, and it's been great. One of our great strategy that we've used is a lot of pop-ups. I am such a big fan right now of pop-ups. I see much result. It's concentrated in the community where they know you, where they trust you. I mean, we've gone from 4 months of not giving numbers to what you all said, the challenges of fear, um, to where they give me numbers and discuss who doesn't have insurance, who doesn't have immigration. People are just open. And now I'm telling you, it's all client driven referrals and advertising and telling my sister and bringing my sister, getting my sister signed up. People know people that need help. That's the bottom line. And I would say food is a gateway to many of underlying and more serious problems. And we are just grateful that we can be a help and be a blessing through Mana. I mean, Mana knows how I feel about them. And, we have wonderful stories. Like today, somebody called, I went for my food. I didn't get it. But one of the tips that I would share, and I know we'll have a schedule, we try to be in communities at least twice a month. You have to be in there. We try to be in there. We let our presence known. A lot of the immigrants communities have WhatsApp. So we are present with them also. Like when we have all these programs, we send WhatsApp. I just had another client, a good client of mine, refer 4 immigrants that had just come to the country. I didn't do it. They do it now because it works. And they're benefiting from it through Mana, through wraparound services. So we create a WhatsApp group. And like she was saying, the computer program, we reach out and we send all these. So they've come to really trust us. And through that, we refer to DHHS. So when DHHS call them, they are not afraid to give numbers because we've already gone through the steps and educate them. And one of the things with Mana, it was hard. Ega knows. But one of the things and also Ega being with us in the community has helped because they see who we're getting from and who are the people that we are collecting information. We'll still see challenges and income. We were out in an outreach in the community, people wanting to report income, people wanted to, and when you see them start to have a setback, like one of the friends here said, is because they don't have the status, the legal status. But and then one of the things that we do, we found that if we create a form, say for example, food intake, and other services that we provide, we don't send them over to the agencies. The moment they start to call, and the agencies are asking, doing what they have to do, but the moment they start to go into some questions, they get nervous. So we've devised a plan where we take all their main information, telephone number, name, and we sign them up, and then we're able through our WhatsApp. Sometimes we have those where we set up our WhatsApp, explain to people, just send minimal information, but we engage them in a call. And so we're going to sign you up for Mana. When you call, they are going to ask you this, but please know that it is for this reason. And so we are seeing them more open. And if they are referring friends and families to us, it's because they're comfortable. So we try to, when we go out, we just don't give DHHS for rental relief. No, we give them ours, they sign up, and then my staff will make a call, to them during the week. And we're seeing that it's working. And like I said, we are present because when you make events, they come in, they want to get all the goodies, be running to work, go through so many tables, but the pop-ups in neighborhoods and in apartment complexes, I think where it's more immigrant and minority concentrated, it starts to build trust. And so we found that, and we take the first lead to answer questions and diffuse all the fears. And sometimes it's just about third-party information, and especially when we're in places where we look like them. I'm an immigrant. I give them my story. And I mean, some people are even bypassing me now and calling Mana and registering friends.
Yeah,
So it talks
that's the
about,
idea behind, is to connect
yeah,
people directly. So when you have that connection for the first time, and then you ask people to come to Mana directly, because tomorrow, if you are not there, that
yeah,
person it's able to come and get the service. Another thing I
yeah,
wanted to share here about what I would like to see in terms of changes of policies is that we don't want to see those candidates only now. Everywhere that I'm going right now, I see them. But when they are elected, you don't see them a lot. We want them to be in the community with us at all the times, so that people can see that they are working on the ideas that they share. It's not just collecting information and not doing anything. So we ask them to be present all the time with us in the community. The other thing I would like to mention here is that not if we are mentioning food, it's not just what we distributed at Mana and in other organizations. I mean, we are also talking about benefit. How do immigrants have access to benefit?
yes,
Some of them may want to have the like food stamp, etc., but they are not qualified for it. So for me, I would like the elected official to remove that qualify, because when you say people should be qualified to have access to something, it's a limitation. So remove it, and if someone is hungry, then the person should have access to food or to any kind of benefit. Don't put qualify. I know that for food stamp, for example, you have to have stayed here for at least 5 years, things like that. And we have a lot of people who just arrive. They don't have anything. They don't have any resources. They don't have documentation to have access to working permit. They don't have, and they're hungry. So and we saw here during the last break and bread that if you are hungry, then you can have physical and health issues. So to avoid those kind of things, for me, honestly, what I am asking is just to remove that qualify and put women as a person in the center of everything. If I'm hungry, then I can have access. Don't look at my income. Don't look at my race or my ethnicity. Don't look at anything, but just give me the food that I need, because, or the benefit. Let me have access to that benefit because I need it. So that's my point.
What you're saying, I was going to share. You said about
we have only 1 minute left.
Oh, sorry. I think it's so true, Mana and Edgar. We have to find a way to come together, to talk to officials and hold them accountable. It's the word, to hold them accountable, that this is what. I just finished an advocacy program, and that's one of my goals. And one of the other things that we offer, like when we go out, we have the Black Physicians Health Network. We offer mobile med. We make sure people are aware of the work program. We offer so many different things that makes coming to us attractive. How we can help you from point A. And the one thing I love to see go out of there is the income base. I can have income. If somebody comes to about food, it means they have a need. So yes, remove that, because you can work 80,000, maybe you have 3 children in college. You have so many other things that leaves you with nothing.
Exactly.
Food should not be a burden. If somebody comes to you, I had somebody making 80,000 come and ask me, but when I said to her, oh my goodness, I'm not too sure, she said, that's okay. Yet I know she's in need to come to me. So yes, with food, let's remove that. I support that. Thank you
so much. Yeah, I will reach out to you because I need people like you in our advocacy task force. Thank you. Anyone else?
I mean, just to say a few words, this is Renaden from CoHealth. Sorry, I joined the meeting late because I was in another meeting, but I have listened to what everybody has said, and I share all those points. I guess on the next meeting, I mean, I will be willing, if I'm available, to share more of the insight that CoHealth can bring on the table. But so far, everything that was shared, I agree with all those points. Thank you.
Thank you so much, Dr. Renada. Any last word from you, Anna? Oh, no, already. Angie, our director, can you say something for the last word, please?
Sure. I just want to thank you for hosting the conversation. It's been good. It's always good to talk about things, even if we've talked about them before, because something new comes up or it reminds me of something that I haven't forgotten. And one thing I want to do, so just thank you to everybody who's contributed to the conversation. It's been really good. Agar, I want to commit to you to giving you some information that I have. One of our former SNAP outreach staff members talked to people while she was signing them up for food or working with them on SNAP and asking them if they would be able to share their language skills with us. And so I do have a list of people who speak a variety of languages, who are community members, who said that they would be willing to support us. So I want to, share that with you in case you might be able to develop some further relationships that might benefit our outreach efforts.
Yes, thank you. You'll be great. Thank you, Angie. So with that note, I just want to thank you again for coming, for joining. Thank you, Stephanie. Every last Wednesday, please connect with us. And thank you so much, Renada, for coming. Thank you, Henrietta. Thank you, Marlene, for always being there. Thank you, Nancy, Anna Rose. Thank you for your support. And I will see you next month. Thank you so much. Bye-bye.
Please, I just want to make one
Bye,
quick
everybody.
announcement, Aga. I work with the Black Health Physician Network. So if you know any somebody who's a Black minority that don't have insurance, whether it's no questions asked, we remove all the barriers. We'll be happy to serve them with health insurance. I also do mobile med, and that is another one. Please contact me, and there are no barriers there. We are able to give health insurance. Thank you.
Thank you so much.
Henrietta, what group are you with? What's your organization?
A Place of Hope.
Okay, thank you so much.
Thank you.
If you don't mind, Henrietta, I will have Ms. Aga send your information to me so that I may send few people to you.
Sure. Thank you so much.
Thank you so much. Enjoy the rest of your day. Bye-bye.
Thank you.
Bye, everybody.
Bye.
Bye.
Thank you guys. Have a great one.
Bye.